This is an example of a lung abscess. So this is a section of the lung parenchyma. This is the outer pleural surface, and the parenchyma is made up of alveolar spaces as well as some respiratory bronchioles here. So if I zoom in, just to show you the background, first of all, so these are the alveolar spaces. You can see the alveolar spaces are they're empty except for occasional alveolar macrophages within them. But the alveolar walls are actually a little thickened than usual, and this is partly contributed by, you can see that there's quite a bit of congestion with lots of red blood cells within them. But for this particular slide, I want to draw your attention to this fairly circumscribed lesion within the parenchyma. So there is an impression of a wall surrounding it that demarcates the lesion from the background lung parenchyma, and then the center contains some cells and then slightly loose collection of cells in the middle. So what is this made of? So if we zoom in closer, so I'm just going to bring you straight to the middle of this lesion. So in the center you see lots and lots of cells. Some of them you may be able to appreciate that some of them have multi-lobated, multiple lobes of nuclei present. So these are granulocytes or neutrophils, and then some of them have much more abundant cytoplasm and a small nuclei, so these probably represent macrophages. And also there are many sort of areas where you just see this pale eosinophilic debris or cytoplasmic debris or remnants, but without any nuclei. So these are necrotic debris. So you have basically a collection of inflammatory cells, leukocytes, namely neutrophils as well as macrophages, and also necrotic debris. So a collection of these is named or termed an abscess, which is essentially a very, very rich inflammatory exudate rich in leukocytes as well as cellular debris. So that is an abscess. And then I want to bring your attention to the surrounding tissue of that collection. You see this area where you have numerous blood vessels. Okay, so this is a blood vessel, this is a blood vessel, and then some of these spaces here. Okay, so these are blood vessels obviously filled with red blood cells. As well as in between those blood vessels you have stroma, which is quite pinkish, with scattered inflammatory cells. So this is granulation tissue. So over time, whenever you have collection or an abscess collection, typically a granulation tissue wall will develop surrounding it, and given time this will organize and become fibrotic. So that gives you a cavity. So that cavity is filled with the abscess collection. So that correlates as well with the clinical finding or radiological finding of sometimes you see a cavity with effluid level, and the cavity, the wall of that cavity is made up by this granulation tissue, and the center of that cavity is filled partly by exudate or fluid, and that gives you the effluid level. So abscess in the lung can form as a result of several things, including infection by pyogenic bacteria. Also, another quite common cause would be an obstruction due to foreign body, for example, aspiration, etc.